Another type of splint we can use, we've used in the past just this smaller splint, and we just bent it, stuck it underneath his arm to support it. But we can also utilize what's called a sugar tong type splint. It's just a name. So this is an 18-inch splint. Sugar tong, essentially, you bend the splint so it looks kind of like a sugar tong to pick up sugar cubes and things like this. So some tongs to pick things up. So for this small of an arm, we've called 911. We're at the park. 911's not too far away. You could either just manually stabilize his deformed arm and wait till 911 gets to you. If you decide to transport yourself, that's on you guys. I would recommend calling 911 because of possible injury to the arm, vasculature and musculature, and then having a higher level of care assessed for circulation, motor sensation. We cover more of that in depth in our first aid course at mf1athrive.com. So how can we use a sugar tong to stabilize his arm? So he broke his arm, 911's on the way. You see the obvious deformity, cut the clothing, expose it, remove any jewelry. We would also want to check for circulation, motor sensation on this. We grab our first aid kit because we said, hey, you go call 911, you go get the first aid kit. As the first aid kit comes back, you're simply supporting the broken arm. Once they get to you, clear his clothing, grab a splint that's going to support the break and the portion of the body above and below the break. I'm going to use a sugar tong today. What you're going to want to do is fold a C curve into this, and this is going to basically cover from his elbow all the way down to his hand. So we're going to put this C curve in there to make it a little more rigid. I'm going to shortchange one end so that I can still see his fingers once we splint him. It's a little bit harder on this mannequin because his arms don't stay up too well, but looks like they're doing all right there. So now with a sugar tong type splint, what you can do is just slide this over the back of the arm, or I could put it underneath like this and bring it around the arm. So I'm just going to slide this in here. It is fairly long for this little guy here. So now we've got some gaps in the back here, and there are definitely probably some gaps under here and under here. I don't want to squeeze this down on the kid's arm or anybody's arm who's got a broken arm. So what you can do instead is we have something rigid. Remember the basics of splinting: something rigid, something to pad the splint with, and something to wrap or bind it with. We're going to go ahead and use this wrap here. So because of those voids, I'm going to use some type of t-shirt material, splint, triangle bandage, things like that. I'm going to start to stuff this. Oops, sorry about that, buddy. Slide this into the splint so that it's nice and padded. So I'm going to line the top portion of the splint and the bottom portion. So I've got some triangle bandage in here. We're going to go ahead and somebody else is supporting his arm. We're going to bring this around his arm. If you need more padding, which on this kid we probably would, what's important with doing this sugar tong is you try, and this is where it's kind of difficult with this mannequin, you want to make sure that this portion is flush with the bottom of their arm if you can. And usually on an actual person, that's much easier to accomplish. So we've gone ahead and padded the areas inside there, padded those voids, and on this splint with this kid, this size, I would need more padding. So we're going to say this is stable enough. You can see his fingers are exposed. That's why I shortchanged one side of this splint right here. So his arm is now stabilized. I'm going to use some pre-wrap tape here to go ahead and wrap around. When you're wrapping around somebody's arm, realize that you could inadvertently wrap a little bit too tight, and that could start to cut off some circulation. That's why it's important at First Aid Community, in my First Aid Community, and at mf1athrive.com. We teach about circulation, motor sensation. It's what to look for and ask the patient after you've splinted. Because you want to make sure that our first aid isn't cutting off their circulation. That'll be evident by color change, tingling, loss of sensation, inability to move. So that's why you want to assess that beforehand. We'll cover that in other videos, and we cover it in our community. So just continue to wrap from away from the heart towards the heart. If this isn't stable enough, you can take this wrap, put a couple twists, and go around the finger to help stabilize the finger. A lot of times, in all honesty, this splint should be underneath their hand, right, to support the entirety of the hand if you can. It does have his knuckles under here, so his fingers are free, but I should probably have tried to capture more of the hand just a little bit more. Then come back around here, wrapping gently, and this is usually where you'll start to see at about this point that you actually, when you're starting to wrap and you're adding some compression to this, it starts to relieve their pain. Now it's stuck in place. If he can sit there and hold his own arm, great. If he can't, you could use this also, this wrap, to create what's called a sling. So I could come up around the back of his neck here, come around his shoulder, over his shoulder here, back around the front, over his shoulder, and then ultimately coming from front to back. The reason why I go front to back when improvising a sling like this is that now that tension is starting to pull the arm in, versus if I were to have taken this wrap and go underneath, it pulls down and pulls people's arms out. Just causes more pain. So essentially we've splinted it. Fingers are exposed. He's stabilized. He's slung, which will help to stop any movement like this, ultimately reducing pain, any further damage. And now we wait for 911 to get to us. Ultimately, if you're sitting here, grab a jacket, put him on your lap so that he's not going into shock. And then you could also pull out your Mylar blanket. These things work really, really, really well. Just go ahead and wrap Junior up in my loud blanket. Wrap him up, cover him up all the way around. Oops, I didn't open it all the way. It is really important when using these. A lot of people teach that this is basically the bare minimum. It's not. We're going to want to cover up their head. So definitely wrap something around their head. Get them all baked potato burrito wrapped in here. Tuck in all these voids so it's nice and tight all the way around their body. Have them sit up on your lap. If they start to become red and sweaty, we're probably overheating them. So go ahead and open up the head here and let that be exposed. And then you're just going to continuously monitor. We know that 911 is just a few minutes away, but if this was a long duration type situation, I'd want to keep checking his fingers every 5 minutes, or at least leave the fingers exposed, cover the head, and continuously monitor him. Please subscribe to the channel, guys. Help push this information out. Consider joining my first aid community at mf1athrive.com, where we'll do a lot more scenarios, cover a lot of this stuff further in depth. Hopefully it doesn't blow away.